thanks, Abby. 7:47 now here on your Wednesday morning. A new report published by the Children's Alliance finds over half of Washington kids experience anxiety or depression. 20% of those kids reported needing clinical care for their mental health, and nearly 1 in 10 kids surveyed in our state have attempted suicide in the past year. That report shows the youth mental health crisis in our state is severe right now, but there is hope to address gaps in kids' mental health care. Author of that report, Reed Saris, joining us live to walk us through some of these proposed solutions. Thanks for being with us, Reed.
Absolutely. Glad to be here.
What barriers are kids in our state up against when it comes to accessing mental health care right now?
Yeah, there's so many. The biggest one, though, is provider availability. So people who are struggling with a condition, parents and kids trying to figure out what to do, and they look for somebody to provide care, and they find huge wait lists and backlogs of access there.
Has this been a problem that's gotten worse since the pandemic for kids here?
It has. It was getting worse before the pandemic, and the pandemic accelerated it. So, yeah, we're at all-time high levels in terms of anxiety and depression, which are the biggest drivers of suffering as far as mental health in our state.
What solutions does your report offer to address some of those barriers you talked about here in Washington State?
Yeah, it's a great question. So we see for provider availability, a big one is telecare. And so actually distributing the availability of care in different regions. So some regions of the state have more providers. Others, you find many counties with not a single psychiatrist available. So the advent of getting care through Zoom and things like that is a big one. Another one that's powerful for adolescents is group-based care. And so that's one where you have one provider who can serve maybe 6 kids at a time. It may not be for every kid or family, but for many adolescents, they report that is as effective as individual care and maybe better than sitting across from one adult on their own to see that their peers are going through similar challenges.
I know this is difficult for parents as well, and sometimes they may not even know this is happening with their child. What can they do if their child is struggling with their mental health? What can parents do?
Yeah, I think the biggest part of the challenge is that there's no system in place. So you have to sort of make your own way. And I think over time that could change, but you have to go to the resources you have. Pediatricians are increasingly building out their ability to refer people to care. So you could go to your doctor if you trust your doctor and say, hey, we need some support. Where should we look and how can we get help? They have rolled out 988. So when you get to a really serious crisis point, 988 works like 911, and you can call in for support and get referrals that way to care, and then resources at school to some extent through guidance and counseling. But you have to sort of be out on your own, running down the possibilities and getting care.
All right, Reed Saris, thanks so much for joining us this morning on this really important topic.